Hello and welcome to the latest episode of the Talking Tradesman. Today in the studio, I have Victoria from Interiors by Victoria. First of all, Victoria, thank you very much for giving up your time to come and
Oh,
talk to me today. And let's talk.
you're very welcome. Thank you for having me.
No problem. So
Mm.
I'll expand a little bit on the introduction. So Victoria is not a trades lady. However, she is very linked to the trades.
Yeah.
So Victoria is an interior designer,
Mhm.
so works closely with tradespeople. However, it's probably best to hand over to you here to talk a little bit about the other thing that you do.
Yeah. So my background is a mental health nurse. So I've been nursing for about 10 years, and I've been working as a colour consultant for the last 2.5 alongside the nursing. So that's where the link is. But yeah,
Yeah.
my background is
Yeah.
mental health. So
It was
yeah.
interesting, actually, what
Mhm.
you were saying pre-record, and we've spoken personally about the link between
Mm.
mental health and interiors, and
Yeah.
providing that sort of like safe space. Would you
Yeah,
say, or
absolutely. Yeah. I think so the point I've got to now is how to use my existing knowledge and bring it together. So I've
Mm,
always wanted to bring those two elements together, so mental health and wellness in our spaces, whether those are commercial or in the home. And yeah, this is the point at which it's kind of converging. So
yeah, it's really cool. It's interesting. It's
yeah.
interesting. We'll get on to that. I think the best thing to do, we'll find out a little bit about you, how you
hmm
got into it, why you
hmm
got into it. So I'm taking it the interior design side of things has come more recently.
Yeah. So
Okay.
I had a great childhood where grew up rurally, so very much kind of like your generation. If we all had our bikes, we'd be out all day.
The best generations.
Definitely not, yeah.
Yeah.
Definitely not a kind of social media world. Yeah, so me and my sister, and I guess had a good time at primary school and things. I think
Mm,
secondary school was more tricky. I had quite bad social anxiety, and it kind of developed through my teens. But I think kind of rode it out. Certainly no traumas like the
yeah.
guys that have been on who've been absolutely incredible. But just kind of finding myself was tricky.
Mm.
Um, and then kind of got through school and didn't have a clue what to do at uni. Went twice, dropped out twice.
Really?
Yeah,
What, out of
yeah.
interest, what subjects did you pick when you first went
Um,
into uni?
I think I thought all I could do was something I'd already done. So I
Mm,
didn't really think there was a world beyond that, which I kind of, looking back on it, wish I'd have maybe had a bit more guidance.
mm.
But yes, I went to study business, spent most of my loan in the first term and came back by Christmas and did the same the following year.
Yeah.
Um, yeah, and at that point, my parents were like, you just need to get a job. Just sort yourself out and get a job.
Mm.
So I started nursery nursing, which was, yeah, not, I loved
Okay.
it. I absolutely loved
Nursery
it.
nursing,
But
little
yeah,
kids kind of thing.
tinies. Yeah,
Okay. Okay.
tinies. That was the first time I'd done anything in care. And I had gone from being quite academic and
Mm,
definitely pushed for uni to being, no, you're going to get on and work now. Um, and yeah, no, I mean, really enjoyed it, but had a kind of period of about 18 months of getting really, really poorly for
mm.
no reason. So picked up every germ that was going. Um, Started
Mind you,
losing weight. Like,
working with little
yeah, and
ones,
definitely
they're
if you've
just
never done
like,
it before,
they're like little germ farms,
they
aren't
are
they?
little
It's
germ
just they
farms.
give you
Yeah,
everything.
they are. But yeah, long story short, I was diagnosed with cancer. So
Oh,
yeah,
wow.
so I had Hodgkin's lymphoma in the lymph nodes in my neck and in my chest, and yeah, it was kind of a bit of a life affirming point.
How long ago was this,
So
Victoria?
I was 21.
Okay.
So I'd been working about 2 years and still very anxious, still struggling with lots of things. But yeah, I suddenly was okay. You're not quite as invincible as you thought you were,
So
because regardless,
you'd noticed you were getting ill,
mm,
gone for a checkup of sorts, and and
yeah,
then,
and you just expect they're going to say, "Oh, you're just run
well,
down,"
you don't
or
expect that.
mm-hmm, mm-hmm. So yeah, so then I had about 9 months of chemotherapy,
Oh, wow.
and it was just a turning point for me. I think probably before that point, everything that was maybe a little bit more minor had seemed huge.
Yeah.
And then after that point, everything felt like a
Massively put
blessing.
everything in
Yeah.
context.
Yeah. Yeah.
Yeah.
So yeah, from that point, I would say things. we're a lot better.
And so you're okay now? You've fully recovered?
Yeah, so I've been in remission for 10 years. So
Wow,
yeah,
right.
so that's great. Yeah, it kind of
That must have been like a sledgehammer at that point.
it was, how do I describe it? I think there was a patch of being like, I could die here, and not, I'd never had that
Mm,
before. Like, I'd had, like I say, a nice childhood, a nice upbringing. I'd never had that much to worry about, and suddenly it was, yeah, this isn't
yeah.
perfect anymore. Yeah.
How was your support at that time? Did you have?
My support was amazing.
Yeah.
My family were amazing. My friends were great. Um, I would say too much alcohol consumption at that time. It was like, have your chemo on a Wednesday, be out by Friday night. I would not recommend this.
Is that possible? I did no idea. So
But
again,
yeah,
I'm not
yeah,
entirely clued
yeah.
up. I thought so. My vision of chemo is like it makes you really poorly,
It does make you really poorly.
and yet you
Yeah,
were still going out
yeah,
drinking.
yeah. I think
Okay.
I was on I would have been on a children's ward in Oxford had I not been on that like 21, 22 cusp.
Okay.
So I managed to have all my treatment on an adult unit. So you could go in as a day patient
Mm.
for bloods one day, chemo the next, and then you wouldn't have another round for a week or 2 weeks,
And you had
depending
chemo
on.
for 9 months.
Mm,
That's a long. Is that a
It was a
normal?
long
I
time.
don't know a
It
lot
was a
about
long
it. Is that
time.
that
Yeah,
seems like a
it was
long
quite a lot of
process?
cycles. I didn't want to have any radiotherapy because the knock-on risk of breast cancers was really high. So it was a
Right.
choice to have additional chemotherapy. But yeah, I think it just changes your whole perspective on
And did,
life.
if you
And
don't mind me asking, but did you go through the whole hair loss
yeah,
situation and all
yeah,
that whole
yeah,
thing?
yeah.
Yeah.
So as someone who did have a lot of problems with my appearance and how I felt I was being perceived, yeah, it was fairly rough.
Yeah.
But like I say, it just kind of got everything in perspective.
Mm.
Um,
Well, it's a lot. Well, I can't remember who first coined the term. There was one of the guests I was sat here, and they talked. I think it was maybe Mark Williams actually. He said talked about a post-traumatic growth, and I
yeah,
just love that phrase
yeah,
now
that's yeah.
because I think once you can start to frame things that way and look at these traumas. I mean, you just sat there and literally said, "I haven't had traumas like your other guests," and then you dropped that bombshell out. I would consider that quite a severe trauma. But the growth from that can like being able to put things in context like
Yeah,
that.
yeah.
Once you can focus on that, I think it just reframes everything, doesn't it?
I think it does. I think it just makes you grow up. I think it makes you
Mm,
appreciate what's important. Um, yeah, so definitely got changed my outlook on everything.
yeah.
And actually, at that point, I was planning to study general nursing, and I did start doing general nursing. But actually, within a year, I thought this isn't for me. Like I'm a mental health nurse. This is
Mm.
what I should be doing. And
So how was the road into that? Because again, it's not something I know a fat lot about. So when you did you actually decide, right, I want to do mental health nursing?
yeah, so now you select from the beginning if you want to be a general nurse,
Mm,
a mental
okay.
health nurse, a learning disabilities nurse, or a pediatrics nurse, and then you follow that route right through. So yes, I did my first year, but I managed to convert across.
Mm,
So that did give me a really good grounding in general nursing too, which means I've been able to do a lot more with the physical health side for my patients than maybe I wouldn't have had that experience and that exposure.
mm.
But yeah, that's the route.
And what's the training like to become a mental health nurse in terms of duration? How does it all go?
So it's 3 years at uni, and you generally have 6 placements in that time. So anything between 8 weeks and 12-week
Mm,
placements, which cover like a range of disciplines. So you will do some community work, some ward work. You will probably work with people across the age
mm.
spectrum, so right from children through to kind of older adults with either serious mental health conditions or dementias. And yeah, so
And do you, with that, do you cover like everything? Because I know, like, one of the reasons you're here today
yeah,
to clarify
yeah.
is to talk specifically, or we want to talk about all mental health. I'm interested anyway, but specifically eating disorders. I know is
Yes,
your
yeah.
specialist area, so we will get onto that. But holding at the training stage, is that like do you do a little bit of everything and then specialize, or
Yeah,
how does it work?
yeah. You get some choice in what you want to do in your training. So if you really wanted to work on a mother and baby unit, or if you really wanted to work with patients with dementia, you could have some say in that. So you had some extra experience. But I covered everything from kind of very acute mental health with men on sort of locked wards to community dementia, to kind of sitting in GP surgeries and being the nurse in the surgery that takes the first mental health referral, and then maybe does some bits of therapy or problem solving with the patients for the next maybe 6 or 8 week period. And then I had a placement in eating disorders, which I absolutely loved. So then decided to work in that area from that. So yeah, you can be quite selective. If there's an area that you're really passionate about, you can definitely follow that.
Yeah, and you locked into eating disorders and followed that.
Yeah.
And how long have you been dealing with eating disorders?
So about 8.5 years.
Oh, wow.
Yeah.
Okay, that's quite intense.
I've done other things in between times, and like now with my current sort of position, I'm doing agency, so I'm actually working with patients with a learning disability and a mental health issue at the moment. So it's
So you sort of dip in. Is that learning disability outside of eating disorders?
Eating disorders.
Okay.
Yes. Yeah. I mean, different things arise with eating and LD, but it's almost its own thing. So
It is quite specific, isn't it? One of the things that I say interests me, mental health. When you think about mental health, it gets put under that massive umbrella, doesn't it?
Yeah, it
Or
does.
we talk about mental health, but there's so many elements within mental health. I mean, I had Monday, for example, I had a chap called Dan Newman, who, touching on the hair loss with yourself, he is a campaigner. Fantastic, actually. His episode isn't out yet. It's one that's stacked up, but he is campaigning to support and help men with hair loss, specifically alopecia, because he suffers with alopecia and he's lost all his hair. But like, there's that one, what would be quite a very niche element of mental health that's affected. And then you've got obviously eating disorders, you've got anxiety, depression, and so many conditions that get put under that umbrella. And that's one of the things I'm trying to do with the podcast, is try and talk about as many as possible. Because I know some of these episodes are probably going to be quite niche, and a lot of people might think, well, that one's not for me. But those that need to hear it, it will be there. And I kind of envisage this as like a library book. Like, the podcast is done, it's recorded, it's published, it sits there forever. And if and as and when somebody needs to pick it up,
Someone can dip into it.
Yeah, that's it. So it's kind of like a romantic view of it, really. But it's like, hopefully this will be there as a resource for people specifically that are struggling with eating disorders, that they can sort of lean into it. So maybe we'll jump into eating disorders in specific. I asked you before we started recording about eating disorders and how is there a big difference between men and women and eating disorders, and you sort of quite enthusiastically said yes. For a kid, we'll go one and then the other, I guess. But what are the key differences, if you can summarise, between men and women?
Yeah, sure. So an eating disorder in general is any mental health illness, disorder, where someone is controlling food in order to manage difficult emotions or difficult situations. So that's kind of the umbrella. And then within that, you have generally 3 diagnoses. So anorexia, bulimia, and binge eating disorder. There are some others, and there is...
Well, I'll just tap the brakes slightly. So if we've got the main 3, can we explain what each of one of those is? I'm going to treat this like an idiot's guide, because although
please do,
I do know little bits, like I do understand what anorexia is, I do understand what binge is. I'm not that sure on what bulimia is, so we'll touch on that. But I'm going to treat it from the purpose of a listener. There's going to be people that know some bits and not others, so we'll try and break down as much as possible.
Yeah, no, of course.
So we'll go for the main 3, and can you explain what each one is?
Yeah, sure. So anorexia, I would say, typically is more a female experience. So that is around the desire for thinness and to control weight. It's much more, it's restrictive, it's fasting, and it tends to be personality types who are perfectionists, who are a little bit more kind of neurotic. All the disorders can start from similar beginnings, but they're those people that are quite obsessive and very compliant people. Then you've got bulimia, which is where a person eats and they feel that they're eating out of control. So they therefore have to follow what they believe to be a binge, whether or not we would classify it as a binge, with a purge. So the purging mechanisms would be vomiting or using laxatives. And alongside it, it can be intensive exercise as well. But it's generally that getting rid of it from your body. And then binge eating is where you're having a large quantity of food in a really short time frame. Sometimes it's spontaneous, but often it's planned. So it will be on an evening, and it won't be an enjoyable experience. It will be cramming the food in as quick as you can, and then sitting with the guilt of it. And I think the statistics are really skewed because so much of the research is revolved around women. But the reality is that just as many men, if not more, are bulimic or binge
Really?
eaters. Yes.
Okay,
Yes.
so men tend to lean towards bulimic
Yeah.
and binge eating,
Yeah.
and women
They
tend
do
to
tend to. Yeah.
lean
Yeah.
towards more the anorexic. Why do you think that is?
Those are kind of your traditional models. I think with the men that have eating disorders, the personality types are a bit different. So they tend to be a little bit more emotionally dysregulated and maybe a bit more hedonistic or an outwardly sense. So those mechanisms maybe work for them, and they're also more secretive. So bulimic, vomiting, purging, and binges tend to be a very isolative thing. And I think if men are already struggling with stigma or shame or all the precursors that are the reasons behind it, they kind of fit that model. They're your kind of traditional eating disorders. I think there's a huge social media element now to both female and male eating disorders, and they're kind of quite different things. But yeah, that's the.
So with that, I mean, again, from outside, from me thinking about what you've just said, I would imagine that bulimia is probably the easiest to disguise because I guess
Yeah.
outwardly people would present
Yeah.
that they're acting on the
Yeah,
norm.
so they would maybe be eating normally. Yeah,
Yeah,
that's true. So maybe eat with their family, but then it will always be disappearing to the
purging.
toilet straight
Right.
away. So if someone's leaving the room within 5 minutes, if their neck is really wide, the glands start to swell up in your neck.
Okay. Interesting.
You'll often see their knuckles will be really damaged, and maybe just difficult with a tradesman. But
Yeah.
if you're like constantly like seeing one
Is that from
hand,
putting your
yeah,
and that damages the
yeah,
knuckles?
yeah, yeah.
Wow. Okay.
So yeah, you might see like clubbing on the fingernails. So lots of physical things.
Right. Is that from the stomach acids? Like
Yeah,
repeatedly?
yeah, that too. Loads
Wow.
of just so many knock-on effects of bulimia. So their teeth might be damaged from the acid as well.
Oh wow.
Yeah.
And what? Okay, so we've got the three sort of main players, as it were.
Yeah.
I would imagine the consequence of anorexia is quite apparent in that it's undernourishment, and
Yeah.
there's been high-profile female cases of anorexia, hasn't there?
Yeah.
The one that springs to mind was it Nikki Graham?
Yeah. Yeah. Absolutely.
Yeah, so she springs to mind as a high-profile anorexia case. In terms of the health consequences of bulimia, what are those?
So
Would that be severe weight loss as well, or?
it can be. I mean, obviously, you can present as a normal weight. The main risk with bulimia is fatalities due to heart arrhythmias. So the issue with purging in any form, so whether you're using laxatives or vomiting, is your potassium levels fall, and potassium is required for heart contractions. So those are the people that tend to just die from
Really?
yeah. So the mortality across all eating disorders is the highest of all mental health illnesses, both from people taking their own lives, but predominantly from the physical health
Really?
consequences.
There you
Yeah.
go. Do you know what? This is why, not
Yeah.
that that's
Yeah.
a high point to pick on,
Mm-hmm.
but this is why I love doing these
No, but
podcasts, because I'm learning.
it's something that we learn.
Yeah, and these are facts and stuff that
Mm-hmm.
I had no idea.
Yeah.
I wouldn't have guessed that.
No.
So eating disorders carry the highest mortality figures for any mental health conditions.
Yes, they do. They do.
Wow.
Mm-hmm. Mm-hmm.
I don't. Have you any rough? Do you know any of the figures?
No, I don't know the figures, but I even, anecdotally, the number of people that I've cared for that have left hospital in a, in a good place. Generally, slightly older patients who've been through the system a lot, and then they will have a sudden cardiac arrest, and
Because of all the stress that you're
yeah,
putting on your body.
yeah,
And then moving on to obviously binge eating.
Mm.
Would I be right in thinking that is binge eating related to obesity? Is that, or would people starve to binge eat?
Sometimes I would say more people are overweight that binge eat because the calorie consumption is big in a sitting. So it might be like 5,000, 10,000 calories in one, like in a 15-minute window. So you do tend to see more people that are overweight.
Yeah.
But again, it's still a mechanism of using food to control those
There's
emotions.
yeah, it's the conversation's just reminded me of a conversation I had with somebody. So I do some voluntary work. I don't know if you've heard me mention Samaritans before,
Yeah.
and the memory has just come back to me of a call that I had with somebody who was talking about compulsive overeating, and the reason I remember it is because they said they were on some kind of like online like club, like group of people that all overeat and encourage each other to overeat,
Yeah.
and they were
Yeah.
setting challenges of like 10,000 calories a day was the figure that was thrown out, and it was like who can do 10,000 calories a day for 10 days. And the person I spoke to, it was upset because I hadn't managed it, and I thought at the time it was like,
it's just so tragic, isn't it? Yeah.
well, yeah, I mean, to me, I didn't even know that kind of thing existed, but to have it showed on two fronts. It showed, one, that obviously it's such a problem, and two, that there's a group of people that are within that condition that are kind of, I guess, in a weird way, supporting each other, but also egging each other on within it.
Yeah.
Did you find that there were like support networks within these mental
There's
health
huge
disorders?
problems in they're called pro-ana groups. So I actually didn't have social media for quite a while because it was so detrimental to my patients, and I was like, I just, this is the problem. And I got to a point where I was like, no, I need to see this and understand this. And the encouraging of, you're not thin enough, your bones aren't showing there, you need to work harder, you need to run another 10K. It's just hidden, and it's worse. Like, it's so much worse than that. The sharing of photos, the fat shaming in people that are stick thin. Yeah, it's a bit like the whole thing with the Bridgend kind of suicide pact. It feels like that.
Yeah, I didn't know a lot about that. One of my previous guests mentioned it. Mark Williams, who lives in Bridgend. In fact, I've spoken to three chaps who all live in Bridgend. But Mark brought up that, and I didn't know a lot about it. But yeah, it's a bizarre thing.
It is a bizarre thing. And I just think for people that are girls, guys, feeling very vulnerable, you are sucked into that. And that's obviously the sharp end of it, but the general kind of social media whirl around our body image and the kind of the body dysmorphic side of it is so prevalent right now that it's just added another level of complexity to it. So the kind of the crux of those three eating disorders maybe 25 years ago would be in that kind of traditional sense I've described, but then now there are so many complicating factors, from how people are perceiving how they should look and what the ideal body type is, guys and girls, probably more so for guys on this actually.
I think, there's a bit of a rabbit hole to go down there, Victoria, really, because I've got my own opinions on social media. But one of the things that social media has done is massively increased connectivity.
Yeah.
So now you've got people that were previously maybe suffering with a niche and isolating condition, it's now so easy for them to seek out. Because I think as humans, we're all inclined to seek out our tribe.
Yeah.
And we're all always desperate for belonging, and whether that's a healthy tribe or an unhealthy tribe. But for people with an eating disorder, it's now quite easy for them to seek out their tribe of people that are suffering the same thing.
It is.
And then it's like the escalation, isn't it?
Yeah, it is. It is.
So, because again, from what I've heard, it's like those groups of people a lot of them seem to like exasperate things rather than try and help each other, which is bizarre.
It's very competitive. It's
Yeah.
So if you think about it, people that are perfectionists and people that are strivers, they want to be the best. So suddenly it's, I am going to be the best bulimic. I'm going to be the best anorexic here.
Okay. So because of that underlying personality trait.
Yeah. And that kind of feeds into what works in therapy and what doesn't as well. So it's, very, lots of levels to it.
Okay. I guess my next question would kind of be the triggers.
Yeah.
In terms of why is this eating disorders, do they tend to be something that starts from a young age, or can they be triggered throughout life? Or
yeah, absolutely can be triggered throughout life. And probably with guys tend to be much later than with girls.
Okay.
So girls, and so if you're my generation anyway, you certainly had that whole, thinner is better, the whole kind of Kate Moss, nothing tastes as good as skinny feels. And that's kind of what you're brought up on if you're that generation. So I think girls have had that kind of body image, expectation, desire in their heads for that much longer. Whereas probably with guys, when you were younger, the only time you would see a guy that was shredded and had that Marvel body was in like Men's Health magazine. The guys you were surrounded by wouldn't have looked like that.
No.
Like,
they were the outliers. I've had this so my son's 17, and the gym people, they were the outliers. I mean, me and my mates used to wrongly refer to them as gym rats, but it was like a derogatory term, whereas now it's a compliment. And I remember, I guess, so I was born in 84, so I guess I'm a millennial technically, but my generation, I look at like my circle of friends, and we were all sporting. We used to play football, rugby, all that lot, but not many, if any, were ripped. It was kind of like, there was some average fitness in there, but it seems to be now the younger generations, my son's generation, for example, they don't go to the pub to socialise; they go to the gym. And they're also, I mean, my son's in great shape, to be fair, for a 17-year-old. He trains at the gym regularly. He's, he hasn't got any fat on him, but he's got muscle on him. He's not skinny, but they do seem to be a lot more focused on their body shape and image.
Yeah. I think they've just been brought up with a different, almost a different catalogue, I guess. Like, they're seeing it, they're exposed to it on social media all day, every day. And I think that's where the difficulty is coming in. So
that's frightening, actually.
Yeah, it's what we're tending to see with guys is what you would call muscle dysmorphia. So a desire to be that body type. And for men, there is only really one body type that is put out there. In some respects with girls, it's come a bit further in that there is a bit more representation of different body types in the media. I think if you...
Well, to speak bluntly, from what I see it, is you're quite right. There was a time where, like, the ideal female shape was your Kate Moss, your super thin supermodel, and now it's lent towards the curves, and like the Kardashian movement, if you want to call it that. But now it's all well. I mean, you've only got to aesthetics, and all the fillers and the implants like women are having now to try and. The key one, I mean, to speak bluntly, when I was younger growing up, it was, does my bum look big in this? Was like, it was like you had to say absolutely not.
It's an insult.
Like, no, it does not. It's tiny. Was a good thing. Whereas now it's like
further end.
It's got, yeah, it's got to look big in this kind of thing.
Yeah.
And there's been a real clear like flip of, you can only call it fashion, really.
Yeah, it is fashion. I think that's the thing to remember, is fashion.
Yeah.
And making permanent changes to your body in line with fashion is something which is not reversible.
Yeah.
You know, everyone loves to dip in and out of, you know, a new haircut or whatever, a new fashion sense, but you can change that. You can't change the stuff you're putting in your body.
Yeah.
So come back to the guys, it's much more muscle focused. So the disorder is tending to be a bulimic presentation because they are very athletic and they want to keep their calories down, but they maybe fall off the wagon, in their eyes, fall off the wagon food wise. And then maybe sometimes with athletes where they're training, that was quite a common thing. Binge eating, where they starve themselves all day and are training and then can't cope in the evening and then consume more than what they would have done through the whole day. And then the three things tend to be huge steroid use, use of supplements, and then just this whole obsession around clean eating and exercise, you know, in the gym 7 days a week and not being able to step off that treadmill. And it's really, really scary. And the damage of steroid supplements, a very clipped diet alone is bad enough. And then you throw in heavy exercise on top of being a tradesman where your body's under strain every day anyway. And like, you're nearly 40, but your body's probably almost a decade older because of what you put it through day in, day out.
Yeah. Well, that's why I haven't done any of that, Victoria. No, don't worry at all. That's why I've just been maintaining my body by not doing any of those things. So, yeah. Wow. Yeah, it's like I say, I'm just sort of absorbing everything you're saying there, but all those triggers and like you quite rightly said, I think social media is a huge contributing factor to that.
I think you're coming in, so social media is a trigger, but you're coming into it with a lot of these people share the same kind of genetic vulnerabilities, I guess, in one sense or another, and then biological, psychological, social things arise. And yeah, they are vulnerable to these disorders. Some more from kind of a compulsive sense, some from more of a neurotic sense. But yeah, there's.
I would imagine, speaking from a man's mindset, there's probably quite a lot of denial.
Yeah,
when it comes to bulimia.
Yeah.
Because I personally would think that if at any stage you consume a meal and then feel that you have to purge it in any way, that would be an issue. Like straight away, even if you do that once, that's to have that thought process is a problem. I would imagine there's probably quite a few men out there that think that it's okay to do it maybe now and again and that they haven't got a problem because, like you said, maybe they've had a meal over there. You know, that fixation on calories. I mean, I've gone through stages of calorie counting. I've gone through stages of not paying it any attention at all. But I could see how easy it would be to maybe focus on 2,100 calories a day, whatever, and to feel that if you've gone over that, you've failed. Therefore, you have to do something drastic to pull yourself down. But then at the same time, think, well, I'm still healthy though because I'm sticking to my 2,100 or whatever. But to have that mindset where you have to take such drastic action, I mean that, you know,
how easily people can be driven to that point.
And would you say, I mean, potentially a provocative question, but would you say the rise of like the online coaches, the fitness coaches that are out there that are quite abrasive, and the targets like that, you know, X amount of calories a day, would you say that's detrimental?
I think anyone who is going into fitness coaching needs to have a really clear understanding of potential vulnerabilities in clients. So some people will be able to manage it and will be able to step off and go, actually, no, do you know, I've managed 3 days this week and I'm knackered and I can't do any more. Or no, I'm going to have a takeaway tonight because that's what I'm doing. So I think the kind of, if there's that relentless pressure being applied to someone that has those vulnerabilities, and the coaches are not really perceptive to the fact that these issues could exist, I think is quite dangerous. Yeah,
So
yeah,
there's a big
yeah.
responsibility there,
There
isn't
is a big
there?
responsibility. Yeah,
Yeah.
yeah.
I mean, I think
Um,
anybody, in fact, actually, if you think about it, anybody that reaches out to a fitness coach
mhm.
realizes that they're in a place they don't want to be in,
Yeah,
because
yeah,
otherwise you wouldn't need the service.
yeah.
So just by doing that step, you're
Mhm.
kind of vulnerable anyway.
Yeah, you are. You are.
So I guess the coaches have
Mhm.
got a
Mhm.
big responsibility,
Mm,
like
mm.
to look after the mental welfare of their
They
clients.
really do. They really do. And the fact that it's all needs to be looked at in the round. It's not just about exercise.
Mm,
It's about lifestyle decisions. It's about positive coping strategies, and not using exercise as like a one fits all. Because then exercise becomes the problem, when it should be something which we're able to build in
mm,
naturally, and for it to be enjoyable. Like, I'm not saying everyone loves exercise, but there should be a point where you go, okay, I've done an hour in the gym and it was difficult getting there, but I've come
mm.
out and I feel better for going. Not, oh my gosh, I now don't want to eat that because that will undo everything, or I've got to be back here at 5 a.m. tomorrow morning. And it's, yeah,
Balance,
balance. It's
isn't
all about
it?
balance.
Got to be
The whole
balance.
thing is, yeah,
I
yeah.
had this conversation with my son
Mm,
before about many subjects, and I've
mm,
said to him, because I'm quite open minded about
mm.
what he does and what he
Yeah,
doesn't do,
yeah.
but I've always said to him it's got to be balanced, and I said to him, if you find yourself that you have to do something,
Mm-hmm.
anything,
Yeah,
every day, there's a
yeah,
problem.
yeah.
So, and that could be, drinking water. Well, maybe not as a terrible example, but it could be, you could get obsessed with doing anything.
Yeah,
And
yeah,
if you have to do it, if you're at a point where essentially it's an addiction,
yeah,
you have to do that thing to feel normal or good about yourself,
yeah,
it's a problem.
yeah,
And I would imagine there's possibly quite a high correlation between people with eating disorders and that transference of the
yeah,
obsession.
yeah. There is, from one thing to another.
Yeah,
Yeah,
yeah.
yeah. So I would say that um, that's sometimes where eating disorders come into play later in life.
Mm,
So if someone has had lots of early life trauma and they've been using a different coping strategy for X number of years, um, they maybe manage to get out of that one and then fall into an eating disorder, and
yeah.
it's almost sometimes replacing an even less helpful strategy with, you
Mm,
know, with another. But I mean, probably the point to make here though is that everyone is using these strategies for a reason. They need
mm,
it. Every person is trying to stay alive, so hence why strategies come into play.
yeah.
A lot of the time they are unhelpful, and I guess in nursing we're trying to bring down the level of unhelpfulness to something which is manageable. um yeah.
So, and we spoke about this pre-record, but my gripe, as it were, with therapies can
Yeah.
be, like you said there,
Mm.
everybody's doing what they're doing to try and survive, try
Mm-hmm.
and cope just day to day. So it
Mm-hmm.
might be that their eating disorder is their way of coping,
Mm-hmm.
and they're masking something,
Yeah, yeah,
whatever that might be, and
yeah,
that's their coping mechanism,
yeah.
although it's an unhealthy coping
Mm-hmm.
mechanism. And then, as we touched on, you can then you can mask that with fitness,
Mm-hmm.
whatever it might be. But you can keep masking, keep transferring the masking from
Mm-hmm.
healthy to unhealthy to whatever it might be. But would you agree that it's crucial to actually address the underlying cause of whatever
Yeah,
is
yeah,
causing the behavior in the
I
first
would.
place?
Um, in eating disorders, it's often abuse, early life abuse.
Is there a high
Um,
correlation to that?
yeah, high correlation. Lots of sexual abuse, physical abuse, um,
Mm,
and often kind of the verbal abuse in terms of never being good enough, always being compared, um, maybe not having that feedback that you are good enough. So, and then falling into
mm.
those realms of perfectionism or those sort of traits in people, this is kind of where it's
I
coming
mean,
from.
when
So,
you think about
yeah,
it,
you do need to unravel.
I guess sexual abuse and body image
Really
do,
closely linked.
yeah, it's a
Yeah,
real
yeah,
sort of straight path between
yeah,
those two,
yeah,
isn't it?
yeah.
Is that the same across men and women, or
Yeah, that is quite similar. I think. the male side, you tend to see, like I said, a lot more shame and stigma with it. The girls are often able to work through it a bit more. That's just because I think possibly they find, this is anecdotally, this is for me, but they maybe find it slightly easier to talk about. Like some of the guys you've had on before that have talked about when the sexual abuse has come up, it's just been with a stranger, or it's not something that they've been able to actively seek out support for or address. So yeah, I would say a lot of the triggers are the same, the two sort of personality types, and yeah, it is very much a trauma-based thing.
I mean, it's your sort of like subject, as it were. What is the best? I know that the word is so, again, it's a bit of an umbrella word, but cure. Like,
Yeah.
how would you recommend or say that is achievable? So treating the symptom of the, the eating disorder, as it were, but the underlying cures, which could be childhood trauma, abuse, sexual abuse, whatever.
Yeah.
How do you go about actually curing it so it doesn't transfer? And would it?
It kind of needs to be done in the round. So the best combination is to have psychotherapy at the same time as taking medication, because the medication helps you to access the therapy at the same time as getting your calories up or eating regularly, depending on what the issue is. So when you're A, in a calorie deficit, or B, eating very infrequently, your mood swings are all over the place anyway. Or if you're not eating at all, you can become completely numb, like emotionally numb. So you can't engage with therapy. So you have to do all three things together. So it's on so the practical side. So as a nurse, I do a lot of the kind of meal planning with patients, and then they will have maybe 3 individual psychotherapy sessions a week, and they use different types of psychotherapy, individual and group sessions. And then they do a lot of DBT skills. So DBT is particularly good for bulimia and binge
Sorry,
eating.
what's DBT?
So DBT is dialectical behavior therapy, which we talked earlier, didn't we, about CBT? So CBT is kind of your starting point. So they will consider how their thoughts are linked to emotions, which they're then linked to a behavior. And once you can understand that, you can then move on to kind of strategies to deal with that. So that's sort of the understanding yourself bit. But what a lot of people were finding when they just had CBT, they didn't actually have any kind of practical strategies to take forward. So they were kind of sitting there like, okay, I know why I'm thinking that and why I'm feeling that and why I'm doing that, but what do I do when that urge arises?
Okay.
So this is a bit like, I'm about to run out of the room to vomit. How do I stop myself in the moment? So DBT is about those kind of accepting yourself and accepting that maybe this behavior is a part of where you're at now. It might not be forever, but how are you going to manage to almost prolong that period, and ultimately after a very long time will stop that behavior. So DBT focuses on mindfulness. It focuses on improving your communication. It focuses on being able to emotionally regulate. And it also focuses on something called distress tolerance, which is when you're feeling those urges, what do you do in that moment? So that how do you delay that action that you were going to take? So it kind of gives you a bit of a toolkit to then build on, where CBT maybe doesn't quite fill that gap.
So understanding is the first step, isn't it? I guess
yeah.
that's true for quite a lot of mental health conditions, though, isn't it? Is
really
understanding that there's a problem or an issue. I mean, I guess around that subject, there's two sort of questions I want to ask within this. I mean, firstly, I guess if you're somebody that's potentially listening to this and has identified anything that we've discussed and thought that might be me, what is the first step that somebody can take to explore whether they might have a disorder?
So I would probably say use the Beat website. So BEAT is the UK eating disorder charity.
Send me the details. I'll
Yeah,
put it in the link.
I will. That will help you identify if some of the symptoms, some of the behaviors look like you.
So is that like an online quiz type thing?
It'll give really good kind of simple, easy read resources. It also has a local service finder, and it has lots of sort of chat facilities. So a little bit like a Samaritans type helpline where you can talk to someone directly, or you can talk to them on a web chat. So that will direct you to local services as well, which might be support groups. Probably, if you think you do fit any of those sort of categories, your GP is your first point of call. Normally, the first step is guided self-help, which will be a CBT basis. And then you are often referred on to a service called IAPT, which is Introducing Access to Talking Therapies. They will assess you for either sort of like a group therapy, if that's felt to be most appropriate, or an individual therapy with a phone, or maybe face-to-face sessions. So there's so much available before you'd even get to to like a ward-based service like I'm talking about. But yeah, the kind of the therapy is the same, and then your GP would link in with any medications which were felt to be necessary, and a community outreach team would look at your meal planning.
Okay. So, the next question I was going to ask was probably a bit more tricky, really. Okay. No, not for you, don't worry. But from a perspective of the person in the theoretical person asking the question, if somebody has somebody in their friendship circle or family that they're now worried about having a disorder, which personally I would imagine is probably more common, is that people are either in denial or hiding it. I think a lot of the time people have probably got an idea, like you said, the running out to the toilet, the purging, all the suspicions, somebody around them in their life is losing weight or whatever it might be. What would you recommend a concerned friend or family member do if they feel that somebody they know is suffering with an eating disorder?
I would, again, probably reach out to one of the charities, so to find out what they would suggest the next steps are. I mean, in terms of what we'd suggest, kind of encourage the conversation if you feel you can. Are you feeling yourself at the moment? Like, you just seem, maybe go in on a kind of, you seem a bit different to normal, or a bit flatter than normal, or is everything okay? And all those kind of normal check-in questions, I guess. And don't make it about food to start with.
Okay.
So kind of try and get a handle on what's going on for them. If it's someone that you feel you can be a little bit more open with, maybe start to be, your appetite maybe hasn't seemed what it was, or are you feeling well in yourself physically, and maybe going at that angle. But I think ultimately, if that all feels too difficult, literally just saying to them, I'm here for you. I can sense something's not right with you. If you're ready to talk, when you're ready to talk, I'm here. If you feel like we need to talk to someone else, I will be there with you. Maybe take those first steps to book that GP appointment on their behalf. It's kind of, it's being the listener again, which I know keeps cropping up, but
absolutely,
being really receptive to them and giving them space to offload. So sometimes you don't even have to ask all the questions. Sometimes that person is just waiting to like word vomit at you and just be like, this is what's going on, and it's been awful. So different routes around it.
I don't know why. I just feel like people would be quite not hostile, maybe that's not the right word, but defensive. That's the word I was looking for.
I think that's definitely a thing.
Particularly around body image. Because I think my concern would be if I were to hypothetically approach somebody that I felt might have an eating disorder, that I would be worried that they would then take that as I'm saying that because they look a certain way.
Yeah.
It's quite a
It
delicate
is.
subject, isn't it?
It is really delicate. I mean, those kind of suggestions are maybe if it's with your child or brother or maybe close colleague. I think if it's someone that you're maybe working with and maybe not someone that's in your kind of close circle, maybe kind of offering them an ear, just a general ear, just a kind of more like a blanket check-in, and kind of encourage the opening up over a period of time. I think, if anyone feels pushed or threatened with it, they're going to resort to their coping strategy,
which would be back to the disorder.
Yes, you come back to the disorder. I mean, if they were someone that was having coaching or they're a regular at the gym, maybe just kind of putting some flags out with the guys there saying, just a little bit worried about this person. Has anyone else got any concerns?
I think that this really is probably more relevant with men, isn't it, with the gym side of things? But it's really important to realise that the extremes operate on both ends of the spectrum. So you've got extreme weight loss or obesity, but you've also got the sort of gym steroid abuse, ultra fitness thing. I have thought that myself on occasion. You see some of these ultra athletes that are out there, and I do wonder about the motivations behind it to sort of like be in the gym twice a day. And I guess when it's a sporting achievement, it's one thing, but maybe social media's got a huge platform, a huge thing on that. I mean, personally, not that I'd ever follow him, but I know, like, I've spoken to so many people that have said they've took insane inspiration from, like, David Goggins, for example. You heard of David Goggins? So does all the ultra marathons, and then it's inspiring other people. But he's so extreme in what he does. It's like superhuman. But then there's people trying to follow in that sort of vein of things, which is really, really extreme.
It is. And I think it's about recognizing what is realistic for your body, because for most people it's not attainable, and it shouldn't be something which is aspirational. I think there's a lot going on with a person like that, like you say. What is the motivation behind that?
It's that golden balance question again, isn't it?
Balance. It's really, really tricky.
I suppose when it comes to, because there'll be pushback on the fitness side of things, because so many people do get obsessive, and I think some of it can be healthy. And with exercise, there's a lot of healthy dopamine, and it, me myself, like, I have gone through stages of training very, very often. I've never got obsessive with it. I wish I had at times, but it's that natural dopamine. You feel great coming out, and again, it's the balances and it's the healthiness of it. Like, going to the gym, we can't demonize that.
No,
it's a very healthy behavior.
Like, I think it's super, super important, but it's in the round. So it's with the right kind of diet, it's with the right kind of strategies. So whether that's journaling, meditation, self-care, like it's the whole package. Like,
I think
alcohol is
anything in life can be summarized with as part of a healthy lifestyle. If it becomes your life, then there's an issue, isn't there? So I think it's just is like just everyone to be aware and being self-aware as well. There's a degree of self-responsibility in all of this, where we've all got to. And I feel, again, part of that is accepting that everyone has mental health. So once you realise you have mental health, it makes you pay attention to it, and then you're a little bit more reflective and self-evaluating of your behaviour, where you can think, I'm getting a bit like that's becoming a bit of a crutch. And all too often it is a mask for something else, isn't it? It's hard because I flip on both sides of the coin, where I'm kind of like, you know what, though, if you've had a bad day and that makes you feel good, do it.
Oh, totally. It's I think it's kind of what I was saying earlier about there is this one male body type in the media right now, and that is what is deemed aspirational.
So we talk, when you say the one male body type, are we talking like we're talking
like the shredded
Thor kind of, Marvel character kind of look-alike?
And most guys' bodies are not meant to be like that. And so if you have got a training program which is pushing for that and that only, I'd maybe be questioning, like, again, where is that coming from? And what is it you want to get out of it? So you want to be fit, yes, but is that much of your identity or all of your identity tied up in your appearance? And I think this kind of comes on to the body dysmorphia bit a little bit. We as a society, like our body's a currency, right? Like you, in theory, you get further if you look a certain way.
Yeah.
But you kind of have to question where is that line with a society that pushes people to be one way and to be very homogenous, and ultimately is paying lip service to anyone that chooses to be a bit more individual and say, actually, that's not me. I'm a great balance, but I'm not going to be him or her.
Well, I think the diet and fitness industry is worth like billions, isn't it? Like globally, but even in the UK, it's such a huge business. And in order for those businesses to keep going, they do have to keep tweaking and remodeling. It's like reselling the same thing.
It is.
But it's almost like actually, touching on design and interiors, you can probably associate it too. Because me being a decorator, it's like what keeps me in business is the fact that fashions change. And it makes you wonder whether underneath it all, it's actually kind of orchestrated. Because by changing the fashion of body shape, whatever it might be, that means now we need a different plan. Now there's a new product to sell, a new way to work, a new thing to... because you're quite right. I look back... I was reading an article a couple of months ago, and it was like there were pictures of beaches in England in like the 60s and 70s or 50s and 60s. And you look at, there's so many elements to this, isn't there? You look at like that demographic of people, and nobody was like Marvel character muscle, but everyone was so much slimmer and like traditionally fit, I guess.
And getting fit through day-to-day activity as opposed to
that's a really good point.
They're not working in desk jobs, so they're outdoors a lot. They're getting vitamin D, they're getting serotonin, all the good stuff from being outside, but they're also just fitness is built into their lives because we were never meant to go and work out in a gym. We are meant to just be doing all of this as part of our routine, like our normal routine.
It's a really good point. Actually, the
it's
more I think about it now, it does seem to be like today's modern body type, as it were, is either one of two polars. It's either extremely fit and muscled or overweight. There isn't much in between.
There's not much in between.
Which, again, I mean, we can look at the sedentary lifestyle a lot of people lead now. Convenience food, the rise of the supermarket. Oh, Christ, we could go down a real rabbit hole here.
I mean, Will, who was on with you a couple of weeks ago, his diet.
Did you listen to Will?
Amazing. Listen to it. Yeah.
You and Will, you get on really well. Will's great. Will's amazing. I sat here, and after Will left, I felt absolutely terrible. So, funnily enough, my diet and everything has changed since Will came in. But I was making those changes around about then. But yeah, Will, he was sat everything he said. I just thought, mate, you've got it right.
Amazing.
You really have on so many levels.
So perfect.
Big shout out, Will.
I try and be like Will, probably about 70% of the time. But I guess with patients, we're often working with like tight budgets and things. So it's about how you can make a nutritious meal that you can make cheaply. So absolutely agree with everything Will was saying. But for some people, maybe the quality of meat that you could purchase at a farm shop, that's not possible for everyone.
But isn't it crazy how that's changed though, Victoria?
Yeah.
In terms of the butcher and the farm used to be the norm. And like Will was saying, like he lives quite an old school traditional life where him and his partner will go out on a Saturday and they'll go to the farm shop, the baker, which I think is brilliant. It's
That's
really
amazing,
romanticized. But that used to be normal life. And now that's like some kind of luxury living.
It is.
Like you've got to be rich to do that. Whereas that used to just be like Mr. and Mrs. Smith. That was normal. Now it is normal to only be able to, if you're on a tight budget, you have to use supermarkets. You have to use, the mass produced, heavily like produced foods. But isn't it crazy how things have gone that way?
It is crazy. It is. I think that is the ideal. I think probably the reality with my job is that we're trying to get girls and guys to be okay with the times when they would have to have a ready meal, or they're going to have a McDonald's or whatever. Like, so try and normalize the fact that convenience has to sometimes be built in. Or realistically, like, there's times when you can't cook from scratch. But I think there's a lot to be said for that. And also, a lot of the foods that he was talking about are those foods that are great for serotonin, for dopamine. They, prebiotics and probiotics and all this kind of stuff.
Victoria, I talk to Will and I'm just smiling because I'm sat here thinking he's going to love this, and I'm going to just get a whole range of told you so's. told you. In fact, there's a group of decorators I'm part of, and Will's in the group, and most of the lads and girls there have listened and all gone, "Oh, we all need to be more like Will." It's been nice, actually. I had a message off somebody who said that since listening to Will's episode, he's like changed his morning routine and now gets up, makes a coffee, and goes sits in the garden. There's sunlight really on your face thing, and I was like, wow, I think I probably need to listen to Will's episode every 3 months just
to renew it in your mind.
Just to be like, oh yeah, that's actually what it is. He's got such a great outlook on life. So
it's a great outlook. So kind of if I would sort of have a plan of, if even on a budget, these are kind of my 8 or 9 foods to try and get in every day if you can. Then it's probably quite close to what Will's saying.
Yeah, Will again.
So young, so knowledgeable.
Honestly, we talked about this story when I met Will. But the very first time I met him, it was like, he's a character, that one, and he was stood there with his handlebar moustache in a bar, and we're all having a beer after the National Paint and Decorating Show, and he was literally there with a cup of tea on a sauce, stood at the bar. Just in his own world, living his own existence, which is absolutely incredible. I've absolutely love the guy. I think it's brilliant. No,
really, really great. So that's I think that was, without going over old ground, I think there was a lot in that.
The one thing that you did mention briefly in the sort of like the summary of how to look at treating it was medication. And I think what you said that was really important is that you need to put yourself on a good level ground in order to start the therapy.
Right at the beginning of my training, I was quite I don't know, I guess it was mixed feelings about who needed medication, but having seen it play out, it really does help you to access it. Like,
are these the medication that you reference? Is that eating specific?
No. So generally for eating disorders, it will be an antidepressant.
Right.
So it will be one of there's 8, but typically one of 6 SSRIs. So
what's an SSRI?
Serotonin reuptake inhibitors.
Okay.
So these are the main category of antidepressants prescribed in psychiatry, but also by GPs. And for eating disorders, it's often combined with a small dose of an antipsychotic, and that seems to be the best combination.
Okay. So that just levels you out mentally in order to then start addressing the problem.
It does. It's people's cognition is really, really poor when they've got an eating disorder. So when a girl or a guy first comes in and you start doing a little bit of therapy with them, you think it's going in. If you ask them an hour later to repeat back anything from your session, nothing.
Really?
Nothing. So, yeah.
It resonated with me, actually, because I'm a nightmare when I haven't eaten. The whole hangry thing is real.
It's real.
And I can't focus. And you do, occasionally when I'm at work and I'm driving between jobs, whatever it might be, I'll skip a meal. I'd never be any good at starving myself, because I know full well that I just can't function. And I try it sometimes, like when I've got a holiday coming up, and I thought, do you know what, I'll have breakfast, I'll skip my lunch, and then I'll have my evening meal. And I think I can do it every day until I get to like 1-2 o'clock, and my energy just goes
and as soon as your blood sugar levels have like dropped off the side of a cliff, you will then be into binge territory when you next eat.
Exactly.
And this is the problem, and that's part of the cycle, is every time you're restricting for longer periods and longer periods, when you then start eating again, for the majority of people, it tips into a binge. because your
Yeah.
body's like, oh my gosh, I need the food when I can get it.
I must admit, since starting the plan that I started, it's actually more than I'm used to eating. It's actually eating more, and because I've
Interesting.
looked at it
Yeah,
with some of
yeah,
it, I thought, I can't eat all this, but it's better food, so it's
yeah,
the calories are
yeah,
not.
yeah.
I've said this before on Will's podcast. You probably heard
Mm.
me say I was stuck in a rut
Mm.
of like the meal deal, man.
Yeah, yeah.
So Greg's in the morning, Tesco
Mm-hmm.
meal deal for
Mm-hmm.
lunch, and like a
Yeah,
packet meal of an evening,
yeah.
because I wasn't prioritizing
No,
myself.
no.
So, which I've
Mm-hmm.
adjusted now.
Mm-hmm. Mm-hmm.
And I'm having decent breakfast. Well, I'm having 3 decent meals a day now,
It's really good. It's really
which is
good.
good. And I do feel a lot better for it. So
Yeah.
I've recognised it. But
Mm.
yeah, it's again, society, it's so easy to fall into
It's
that
so
trap.
easy, and it's not. It's like most of the time, it's not anyone's fault. It's just the
Mm,
way we live, and it's having to plan, which is quite a difficult thing as well. And if you're in tradie jobs and you're in a different
mm.
location, maybe you're not in the same job all week, and you're dipping in and out, and you're thinking, oh my gosh, actually, I'm not in the right place to shop today, or I haven't done my prep. You're going to grab something quick.
It's just a thought
Um,
that popped into my head then.
mm,
Why do you think it is that, because when you reach out for help, generally it's with like
mm,
a PT or a
yeah,
trainer,
yeah.
and it's very much like gym and food
Mm-hmm,
focused.
mm-hmm.
Why is there not so much of like just a nutritionalist that's just like a
I
food
know,
coach?
right? I agree.
Job for you
Agree.
there, Victoria. Very well qualified for that position. But
No, no, I agree.
why
I
is there not
think,
just food
yeah,
coaching?
I think the yeah, there are people that work, I guess, as dietitians, but they're always
Mm,
looking to maybe address an existing problem or a problem which is very obvious or
yeah.
diagnose, as opposed to actually look at the diets of the majority of the people in the
Because
UK and think, actually, where are
yeah,
we needing to make
well,
changes?
I saw an article the other day, and it's probably not factual, but it likened the amount of energy exertion
Mm-hmm.
from decorators and
Mm-hmm.
roofers to that of people training for pro boxing.
Yeah.
So then I kind of thought, well, if that's really the case, if you just sort your nutrition out, you probably don't need the
Yeah, no,
gym
agreed,
side of it.
agreed. Which will take you back to that older school.
Physique,
Your physique, your
yeah.
work is your exercise. Yeah, yeah,
Quite
completely.
all these puzzle pieces are
I
dropping
know,
in
just
for me
dropping
now,
into.
because you're quite right. It does seem
Mm,
to be then that push for the
mm-hmm.
Adonis body.
Body. Mm-hmm.
Um, it's mad, actually. Yeah,
Mm-hmm.
just all these things are clicking in my head. I just thought then, do you know the film 300?
Yeah, yeah.
I remember watching the film 300 and thinking, Jesus Christ, like all these lads
How
are
do you look like that?
ripped, but they were the outliers. That
Yeah,
was
yeah,
the
yeah,
abnormal.
yeah, yeah.
Now, like the lads in 300, it's kind of like, oh, that's just what men look like.
Mm-hmm.
It's,
Mm-hmm.
it's not.
And that's why it's so tough for guys. I think,
Mm.
yeah, I think there's been so much
It's a lot of pressure, actually.
spoken, yeah, and that makes it more of a concealed disorder as well, because
Mm,
there is so much pressure. And I do, well, coming across anti-feminist here, I think the more girls do, the more tweakments, the more changes,
mm,
the more pressure to be, oh well, my girlfriend looks like this,
yeah.
she's had this enhancement, so as her boyfriend I need to look like this.
Mm.
It's just another, I don't know, like another level of it.
Yeah, I mean, it's
um
interesting. I mean, as you know, my wife's in aesthetics and
mm,
all that
mm,
kind of thing. And one of the interesting conversations I have with her is she will often say that the treatments that women have done
mm,
are not for men, they're
mm,
for other
mm,
women.
mm,
And I think it's the same with men in
mm,
terms of the gym. They don't
mm,
necessarily go to the gym because they're trying to impress women,
mm.
it's the other men that are
Yeah,
judging them.
yeah, yeah,
And I've got a couple of my friends that are heavily into the gym, like bodybuilder
yeah.
kind of situations. And when I look at their social media posts and they'll post, pictures of their physique,
Mm-hmm.
all of the comments,
Are from men.
it's not
Mm,
women,
mm,
it's
mm.
all other men.
So maybe it's just being, yeah, similar need to impress, appeal to, appease the same gender.
Yeah,
Maybe, yeah,
it's
maybe,
the social norms thing again,
yeah,
isn't it?
yeah.
Yeah.
But no, I just think it's interesting how we're we're in this society of we all need to strive for perfection. We're
Yeah.
humans. We're never going to be perfect. That's our charm, but we're losing our charm. We're
Mm,
losing our individuality because we want to look like X, and X is currency. And I don't know. It's just like that cycle.
yeah.
And at some point, it's going to have to. I think it's going to have to revert, but
Yeah,
yeah, like how far does it go? And I guess, like, does Angie have people come in where she has to go, actually, you don't need that?
yeah,
Yeah.
yeah.
You don't need another Miller filler.
Yeah, so I mean, I've got my own opinions on certain treatments, and there's a business side, and then there's a
Yeah.
personal side to it. But yeah, I mean, Ange, in credit to her, she's very ethical, and I know things like the problem with that industry is it's so unregulated.
Yeah. Yeah.
I mean, she's very ethical and she stands by her morals.
Yeah.
So I mean, the easiest example is say lips. If somebody comes in for lip filler and they're only meant to put, I think it's a miller filler at a time at most. But some girls will come in and be like, I want 3 mil. And they'll be like, look, we
Yeah.
can't put 3 mil in, but we'll do
Yeah.
one. If you want more in
Yeah.
6 weeks' time, come back. So she will actually refuse and say, I won't put more
Yeah.
than
Yeah.
that
Yeah.
in.
Yeah.
But you know for a fact that that
They'll go up the
person
road. I
who
know.
somebody will do
Yeah.
it.
Yeah.
Somebody will do it.
Yeah.
And again, Ange will look. She's big on. She did like a course on facial balancing. So where they look at the whole face, what works, what
Yeah.
you know. And again, you've got people who are less ethical that will go, yeah, you want 5 mil of
All of
filler in your
this.
cheek.
Yeah.
We'll whack it in.
Yeah.
She will actually go, it's not going to work.
Yeah.
I don't want
Yeah.
to do it.
Yeah.
So yeah, there's a big ethical debate in that
There is.
industry.
There is. Yeah. Yeah.
And then I guess there's the other side where you go, well, it's free choice.
Yeah,
But
it is.
then,
It is. There is always that balance. And I'd
yeah,
say, if we come back to mental health in the round, everyone
but then it's
is
kind,
free to make
yeah,
what we could deem unwise decisions.
yeah.
Like,
But
there's,
the further you zoom out, though, you
yeah,
kind of go, but is it free choice or is it manipulation
100%.
higher above that then
Yeah.
makes you want to make the choice that you feel entitled to make?
Yeah. Yeah.
Christ, we could go down real
It's a
rabbit
whole,
holes
that's
here,
a whole rabbit
Victoria.
hole. Yeah.
Yeah.
Yeah. Yeah.
I mean, I guess, so we've been talking a lot about men in the trades
Yeah.
and male trades. And I guess
Mm-hmm.
to summarize eating disorders within men in the trades, the key things to watch out for more likely are the bulimia
Yeah.
and the like super overtraining, obsessive kind of
Yeah,
things.
there is. It was sometimes deemed as orthorexia, so the clean eating and the training. And I guess the problem is it's deemed as very virtuous in society. So, like you said, it's
Yeah.
very difficult to then say you're doing something wrong, or wrong
Yeah.
is not the right word, but you're doing something excessively. Yeah, that's where it's difficult at the moment.
And remind me again, first port of call, what was that website?
So Beat
Beat. Is
the,
it just BEAT?
BEAT, yeah.
Okay.
So it's like beat eating disorders, but Beat.
Right. Beat, yeah.
And your GP. And I would say GPs are so much better than they've ever been before at recognizing, at dealing with things sympathetically. And if you feel like you have one close friend, family member, relative, partner you can go to, honestly, opening that conversation, once you've made the first steps, everything becomes easier. It is that whole.
And I would imagine there could be situations where it's a little bit like planting a seed.
It is, yeah.
And sort of
yeah.
I mean, I'm not a professional, but my sort of advice would be to tread very gently, plant the seed, maybe go about it delicately and sort of say, look, you've noticed a change. Is there an issue? If there is, please talk to me.
Yeah.
But then don't push it.
Yeah.
If somebody says no and doesn't want to talk, don't push, because then you'll get the pushback and the defensiveness. Let it settle, plant the seed, and you might find that the person that you're concerned about might approach you in a day, 2 days time, 3 days time, once they've had chance. Because sometimes when you're so embroiled in the situation yourself, you don't really realise.
No.
And you can need somebody to just illustrate
and it
that.
feels like an attack. It feels like this is my mechanism. I am dealing with this in the best way I can. And I think that's the bit we all need to be really mindful of with all mental health conditions. Even if we see a compensatory behavior, whatever it is, whether it's using alcohol, using drugs, whatever, they are doing something to mitigate how they're feeling. So it might not be the dream scenario, but yeah, totally tread carefully, because everything feels like a personal attack on your coping strategies.
That's really important. You said that, actually. They're not doing it, for the fun of it. They're doing it because they're struggling.
I'm going to hit the bottle today because this is going to be fun.
Yeah.
Like, they're not.
Yeah.
It's...
And at the same time, if devil's advocate, if you're the person that is approached by somebody realise that that's coming from a place of care, concern, and love,
yes,
and that
100%.
that person does want to support you. So just, if somebody does raise your behaviour, even if you think that you've got it
Yeah,
under control, just have a little bit of
yeah,
self-examination. Just have a think. Maybe go onto that website, pop your details in, and see what it says. Be honest with yourself, because people are out there hopefully trying to care for each other. But that's great. Like, that's brilliant. I
yeah.
feel that we've covered that really well. The one thing I don't want to overshadow, because there are more and more women coming into the building trades,
Yeah.
and I've got a lot of female listeners, so they'll be
hmm
there going, "What about us?" So,
hmm
what about them? The women
So
and the eating disorders, and
yeah.
whether it's people in the trades or outside the trades,
hmm
or as well as that, really important to say here, there might be a lot of men listening to this, men in the
hmm
trades.
hmm
We've got wives, we've got mothers, we've
Yeah,
got
yeah.
sisters. So being able to recognise eating
hmm
disorders in
hmm
women. So let's lean towards the female side
Yeah,
of things a
yeah.
bit.
I mean, yeah, so definitely true for females, probably true for men as well. You are getting those behaviors where food becomes more secretive, where someone is probably saying to you, I've already eaten, but you haven't seen
Mm,
the evidence for that. Where someone might be saying, do I look okay? Do I look the same? Do I look thinner? Lots of kind of body checking and
mm,
seeking that reinforcement from external people or sources. Like I say, it tends to be a little bit more restrictive, but if you've got women who have maybe more of a borderline personality disorder presentation, so that is more emotionally dysregulated, where they have kind of swings in mood through the day
mm.
anyway, that is more likely to be accompanied by vomiting, purging, those sort of
Okay.
actions. Even things like if someone is walking for 6 hours a day,
Mm,
sometimes husbands will come home and they will think, "Oh, where's my wife? Where's my partner?" And they've been walking all day. This is a real big thing with patients. And if they are a user of laxatives, they get banned from pharmacies quite quick. So they
really?
actually have to create a massive walking loop just to get the laxatives they need for a day. Like, we're talking hundreds of laxatives.
Oh,
So if a
really?
pharmacy bans you or lets you only take like 10 a day or 20 a day, that's a lot of trips. Yeah. So sometimes,
Wow.
like, if you're not
Key
sure,
presenting
yeah, kind
factors.
of just
Yeah.
being aware of maybe their um, not tracking. That sounds awful, but just be aware of where
Mm,
they are during the day.
yeah.
Um, yeah, lots of different factors, and then I guess just general change in appearance, looking
Visual weight
pale,
loss.
physically not very well,
Mm.
tired, picking up germs easily, all those sort of factors. Um,
And I guess that's because I mean we're focusing kind of on the anorexia side,
yeah.
so like binge
Mhm.
eating as well being any. I guess all
Mm.
three are
Binge
the
eating,
thing.
maybe with the planning side of it, if
Mm,
you've got a partner who is going to Tesco's and buying 12 packets of biscuits, 18 bags of crisps, like big carb heavy snacks, and then you never
mm,
see those snacks.
yeah,
It's probably a
yeah,
planned binge. If you see a change in presentation after meals, so say a purge, like a vomit, has been unsuccessful, you might get kind of someone coming down looking unwell and all
mm,
those things I said earlier, but psychologically they're going to be in a bad place because they're then dwelling on the calories
yeah.
they've absorbed. Um, Vomiting is actually really quite unsuccessful in terms of getting rid of calories, but
Mm.
yeah,
And again, I guess the steps to treatment or addressing it are exactly the same as
yeah,
what we
they are.
discussed,
They
aren't they?
are. Yeah.
Interestingly, what you when you mentioned about the split personality there,
Mm,
what popped into my mind to ask was: is there any correlation between neurodiversity and eating disorders, or
yeah,
like
yeah,
increased risk?
absolutely. So, I would say probably a third of my patients at any one time are autistic. So yeah.
Okay.
So sometimes this is a bit like we were talking about earlier. Actually, I was going to bring it up with LD.
Mm,
It sometimes starts as being a child who's picky with food, or deemed as picky with food, but really they're not comfortable with different textures, or they like beige food or bland food.
mm,
And then sometimes that can become a disorder in itself. sometimes it doesn't have the same. Sometimes it doesn't have the same background, in that they don't enjoy or experience food in the same way that your average person might. But it also is a huge mechanism for control. So particularly in girls where autism is poorly diagnosed at school age, teenagers, it is a really great method of keeping your emotions in check. It becomes detrimental, but like I said, with anorexia in particular, you become numb. So when everything around you is overwhelming, the ideal strategy is to numb yourself in some way, and denying yourself food is a way you can do it as a teenager
Yeah,
or
it's like a
young adult.
I think there's something to be said for that, though, isn't there? About for people who feel that their life is out of control,
Yeah.
that they'll grab onto the elements that they can control,
Yeah.
and eating is quite a most people can control that.
It's an accessible thing to most
Yeah.
people, yeah.
Yeah. So again, I guess you got to look at potentially if we got parents listening here and you've got children, is look at your family environment
Yeah.
as well. See if there's disruption. I would imagine, again, we're maybe going a little off subject, but I would imagine things like relationship breakdowns in parents could be a
relationship
trigger.
breakdowns, periods of illness in parents, or changes of school, changes of schools, lots of different things. And actually some of these things don't run their course until people are in their 20s or even their 30s, and suddenly it dawns on them that they're in a similar situation in a relationship to their parents were, and there's a kind of reawakening of that trauma, or they have a relationship breakdown in their early 30s, or they can't get pregnant. It's a big trigger.
Okay.
Yeah, so
do you know what? We're so fucking complex, aren't we?
So complicated.
So complicated. There's so many things.
So many things, yeah.
Yeah, it gets a bit scary when you start listing it, and you sort of think, Christ, it's like walking through a minefield here. But I think
the point you've made a few times though, about we're still animals. We still have very reptilian brains for the most part. Like we can't, the number of decisions we have to make in a day is not conducive when you are still in a fairly prehistoric brain.
This is it. I found evolutional psychology fascinating, and the reference between where we are now, designed to be hunter-gatherers, living in small tribes with so much less stimulation than we currently have, and how we're now adapting to it. I mean, it's equally terrifying and fascinating for me.
Yeah, it is. I agree.
So the way that so I had this conversation with a friend of mine who's very intelligent, and I was saying, we're not designed to live in the world that we live in, and his response was, well, we must be, because we designed it. So how can we not be designed to live in this world when we are the architects? Which kind of made me go,
very good point.
Oh yeah, I still do believe that the majority of us and our evolutional state, and I think our happiness. I think again, I've looked at the facts and figures in things like depression and suicide rates between the Western world and the Eastern world. Eastern philosophy still being a lot more spiritual, a lot more old-fashioned, family tribe based, and they are on paper far happier. Even some of the much more impoverished areas.
Yeah, completely. I mean, the majority of the people I work with now are of African descent. It's about 70% of my team, and their views on life and their ideas about mental health are amazing. I mean, so refreshing, because they have a different value on kind of like what you need and what the ideal
values
life
and cultures
looks like, and their cultures. I find it amazing.
Actually, it's a good point to sort of touch on eating disorders and cultures. Is there a difference between? Is there more of a risk, less of a risk?
Yeah, there is. So much more in kind of Caucasian, white, British than in minorities, but that's not to say it doesn't exist. So
no, of course,
I do have quite a few Muslim girls, and arguably you can hide your weight loss quite easily by what you're wearing. So often it's got a lot further before the families maybe realise.
I did wonder, and forgive the train of thought really, but my train of thought was, I wondered if there was a correlation between increased rates, say in certain ethnicities, such as, you know, the Muslim culture, because of the control element and
Yeah.
obviously the way that cultures live,
Yeah.
and wanting to, again, like we were talking about, children that are more inclined to, if they feel out of control, try and control what they can.
Yeah.
Just wondered whether there was any correlation.
Yeah, and I don't know statistically, but certainly in my experience, it's there is definitely a subset of different cultures, but maybe slightly different reasons. I mean, yeah, I would say maybe more controlling things happening in their home life, or very describe it, very sort of particular living situations which we maybe wouldn't appreciate or wouldn't
Then,
find
yeah, but I guess
constrictive in the same way. So
to
but
counterbalance
yeah,
that, certain other cultures have got a much healthier relationship with food than
yeah,
what we
that too
have.
though, that
You know,
too.
they still eat as a family.
Yeah,
They
yeah,
eat better,
yeah,
healthier, fresher food.
yeah.
There's more traditional sort of dynamics of the family where
Yeah,
you've
there is,
got
there
the
is.
elders cooking a meal every day,
Yeah.
and that kind of thing. So I guess maybe that counterbalances.
And the thing you've said quite a lot about both parents going out to work now,
Yeah,
in a lot of these cultural homes, you have grandparents there too.
yeah,
So even if both parents were out, a lot of the children still have that support, which has definitely helped in their recovery.
yeah.
This is with my very young people with eating disorders, but they are used to sitting and eating at a
It's more
table
natural
all
to us,
together. It's
isn't it?
amazing. It's really, really
Yeah,
great. So sometimes it's harder when you've got a teenager that is going home to an empty house, and they'll
yeah,
say, actually, I'm not going to have a parent in until 8 o'clock.
yeah.
And so potentially they've had a 12-hour day of not being, no one to check in with them about their eating.
It's
So,
frightening. It really is. And it does concern me as to where we're heading with it. And I just had a thought then of my own family, and I thought, you know, traditionally, or evolution, like from an evolution perspective, it wouldn't be normal for your family to be spread out all across the country. You'd be
no.
quite
Yeah,
isolated, and
yeah.
again, more in your little village town tribe. Whereas now I look at my family, and you know, we're all over the place.
Yeah.
And yes, we can connect now through non-traditional means like social media, phones, and all that lot, but we are really spread out.
Yeah.
And the reality is, if you actually equate the amount of time per day we spend with each other, it'd be very, very low
Yeah, it's really
in
tiny.
comparison. I mean, you know, dial right the way back. Sunday, you know, I'm fortunate enough to remember the days where on a Sunday everything was shut.
Yeah. Yeah.
You know, there was nothing open, so it kind of forced you.
Yeah.
You had to spend time with your family because nothing was open. You know, you'd sort of say, "Oh, should we do this?" But Sunday, it's not open.
Yeah, yeah, yeah.
Whereas now we're in this like 24/7 culture
Yeah.
where everything's open all the time, and it's weird because you kind of think that it makes everything more convenient, but in reality, it actually drives us apart more.
Yeah.
Because it gives us reason to not spend time with our loved ones.
And it doesn't give you downtime. Like there is
Yes.
no stop in the stimulation.
Yeah.
You know.
Working patterns,
yeah,
you know, they've all changed, haven't they? I know some people that do like 4 days on, 4 days off. Weekends are no longer a thing.
No.
You know, Saturday, Sunday doesn't really mean anything anymore. So there's all these ingredients coming into the mixing pot, Victoria, isn't there? That potentially not in a good way.
There is.
Yeah, frightening. I mean, I guess that, again, devil's advocate on that is there's also now easier access to all the help and information.
There is. And it's, I mean, the positive thing is that mental health is recognised more and prioritised more in the UK than in any other country in Europe, apparently, statistically. So more people in the UK will say, I'm having difficulties with my mental health, and believe there is support to help. And there is, and support is there, which is the best you can kind of hope for. So yeah,
that's great.
Yeah.
Yeah, there are. I'd have to check myself now and again because I feel I'll get a bit like doomy on things.
No, it's
so
not.
I always try and like
Yeah,
counterbalance between, well, society's going bad, but there's these good bits, you know.
There's great bits. I think the fact we can connect and we can learn so much is huge. I think there's so much good we can be drawn to focus on that. But
I think we've covered eating disorders very well. Before, there is something else I want to talk to you about,
Yeah.
being what you're doing now, like the
Okay.
design and all that
Yeah.
kind of thing,
Yeah.
because that interests me.
hmm
But before we move on to that,
hmm
is there anything that you
Do you want to talk
think?
general mental health?
Yeah, well, and with what you're doing with your business in
Of
terms of
course.
the
Yeah. Yeah.
design and the
Yeah.
importance for mental
Definitely.
health, I want to talk
Definitely.
about that because it's of
hmm
interest. But
hmm
before we move on, is there
hmm
anything around eating disorders that you think is important to discuss that I haven't or we
Um,
haven't?
I think just trying to be really self-reflective and self-analytical about what is going on for you, what purpose your eating habits, your exercise habits are having, why are you doing it,
Mm,
um, and kind of trying to maybe reflect on where this is going, because I think it is one of those very compulsive things where you can
mm,
end up 10 steps down the line without realizing what starts out as well-meaning, well-intentioned dietary changes can quickly escalate.
mm,
So yeah, I think it's very much that, trying to take a step back and look at, am I using this as a coping strategy, or is this something which fits in my general lifestyle and my desire for a healthy lifestyle?
mm.
Mm-hmm.
Yeah, yeah, no, well said. Yeah, perfect. Okay, so Interiors by Victoria.
Interiors,
And
yeah.
the whole what I love is
Mm.
that you messaged me and you were asking me about
Who is this girl? What has she
what
got to do with tradespeople?
no, I found it interesting when you were asking me about my own home space and did I
Yeah, yeah,
find it
yeah.
relaxing and that.
Mm-hmm.
So
Mm-hmm.
let's talk about that in terms of obviously your mental health experience
Mm.
and then bringing that into interiors.
Yeah, yeah. Um, so I've worked across a lot of settings,
Mm,
and your community settings, so seeing people in their homes, working with people on their rehabilitation in their homes, working with people in very severe conditions in acute units. And then with my own house, me and my ex-partner bought a derelict house, so it was a big project, and we
mm,
did everything ourselves. So I've had lots of kind of um, sort of things happening at the same time where I've considered, what does this mean, and
mm,
how can I make this feel a certain way, so that it is somewhere where I find rest, where I find it
mm,
invigorating, where I get what I need from a space. And I think I've seen so many people in their homes where you will take them back after a discharge and you'll start seeing them in the home and you think, oh my gosh, my mental health will be bad here. This is chaos,
mm,
like so much stuff, just not able to make head nor tail of it. And I think if I started my day
mm.
in a bedroom like that, I wouldn't be starting from a
Yeah.
good point. And the same with wards. I mean, I was always quite fascinated with the design of mental health units. So they're designed so that everywhere is visible at any one time. So
Everywhere's
visible.
visible,
So they're
right?
quite often like a V, so like two corridors with maybe an office at the center.
Ah, okay.
Um, but actually, if you're someone who is psychotic and you're thinking everyone's watching you, the reality is everyone is watching you.
Right, yeah.
So sometimes they're kind of a perpetuating environment.
Mm,
Um, and color schemes. Color schemes are awful. So
mm,
yellow is quite often a polarizing color. So some people find it great, but other people find it really irritating. The number of
I'm not a big
mental
yellow
health
fan,
boards
actually.
which are painted
Yeah,
yellow is shocker. Shocker.
really.
So just lots of
Why
little
yellow?
things coming together, really.
Do you think they go yellow because it's like sun, spring, that
Maybe,
that sort of
or just
association?
yeah. Or you go
Yeah,
Farron Ball, India yellow is the color of cow's
yeah.
wee. That's what it's named after.
Really?
Yeah,
That's like a goldy,
I know.
goldy
That
color, isn't
goldy
it?
one. So cows that were fed mango leaves. I know this is very Farron Ball.
I hope all the painters are listening to
That
this.
is the color. They pissed that color,
Yeah.
which is always great when you're talking to a
Would you like cow's piss for this room?
very affluent
Yeah.
couple about, would you like cow's piss on your walls?
Mm,
Yeah. But yeah, no, yeah. So yellow in general is a polarizing color. Um, And
It's interesting,
just
actually.
so many factors.
So I work for a few interior designers myself and have done over the years. And quite often they'll talk about the mood of a room.
Yeah.
And when you actually break that down, that is allocating an emotion to a room.
Yeah, it's, yeah.
But we quite often ignore that,
Yeah.
And what you asked me a while back was as a tradesperson,
Yeah.
quite prevalent here. Now, I
Yeah.
know a mix. If I'm honest, actually, I think it's probably the female decorators that I speak to that seem to take care in their own home. Actually, no, there are a couple of lads as well. I'm not one of them. But generally, a lot of tradespeople completely neglect their own home. I mean, admittedly, my space, we moved into a newly renovated house 5 years ago, and it is literally magnolia walls, white ceilings.
Oh.
I hate magnolia. I've painted one wall in the house. That is it in 5 years.
What about your boys? Did you get your boys in to do the rest? No?
I have done that in the past, not in
Not
this
with his
house.
house.
Not
Not
in
with
this
his
house.
house.
Or did I get the kitchen done? But yeah, I have always in the past. I mean, to me, that's business because one, I don't like working at home. Two, it depends what you're doing. So if you're doing a job at home and it takes a few days, then I would rather pay one of my lads to come in because I pay them less than I earn, and I'll go and work on a job and I'll pay them to decorate my house. But yeah, I'm not my wife will hate me for it. I'm not a big fan of working on my own house because it's the busman's holiday thing.
It is completely. And I think that's such a thing.
However, when you framed it to me of, but how do you feel when you come home? I was like, oh shit. It would be nice to walk into like some of the finishes I deliver for customers. I walk out thinking, that's mint. Like I wish that was my house, or it'd be so nice to come into that. But I don't give myself that.
No.
So yeah.
It's really interesting. When you work in a trade, the last thing you want to do is do your trade at the weekend. And when you do, it's probably for friends and family. It's never for you. And the reality is that so many guys and girls don't have that restful, or whatever they want it to be, restful space, energizing space. Yeah, whatever the mood you need for a certain purpose is not met in your own home. It's really interesting. Like, I think you go into design thinking it's all about how do I want this to look, but it's not how do I want this to look, it's how do I want this to feel. And that's very, very different. So all the kind of questions that I would ask a client are around, and this is how it kind of links with the mental health, are around their identity, who they are as a person, how they live their life, what they love doing, who they love spending it with, and then kind of questions around, does your home have a sense of belonging? Does it reflect who you are as a person? If I come in, I want to be like, this is Russ and Angie's house because I'm feeling them through it. And that's so, so rare. Instead, you come home to a white box when you've been working in beautifying other people's spaces all day. And a white box is like a prison cell. It's not good for anyone.
Yeah, you're right, yeah. Shit, I've got to go and decorate my own house now. She's gonna clip this part of the conversation and put it on repeat until I paint the house. But no, I agree with you. I fully agree. It's actually really nice to hear the passion that you've got for it, which is really apparent. But it then made me think that actually, what a great link to have worked in mental health and then work in interior design, which I probably wouldn't have put together before. But now hearing you talk about it and thinking, well, actually, your profession has been getting to know people and how they work and how their mind works. And then to stick that together to where we live, which should be a haven.
And should be an extension of you.
Yeah.
And I think that's
actually a great combination.
Thanks.
Yeah, that's really cool.
Yeah, I am really, really passionate about it.
I can tell. Yeah.
I think I read something the other day which was basically saying that we've all lost our intuition, and it's so, so true. Like, we look, very true of mental health, very true of interior design, especially if you look at the Instagram world of feeling, oh, I like that. Yeah, that's my inspiration. I want it to look like that. But that isn't you. You don't live like that. That kitchen's never going to look like that for you, or work like that for you, or feel like that for you. You're going to feel stressed. That's not your vibe. And when you say lost our intuition, we're looking for external sources of validation all the time. We're saying, these are the experts out there, it's not me. Whereas the reality is, we are the expert. We are the expert with our own mental health. We are the expert with our own homes. It's drawing that out of people. I don't tell anyone what they should do in either job. I let them find it. I hopefully help them find it.
So you're almost like a tuning stick for their
Tuning
own,
stick.
for like their
Yeah.
own thoughts. You just got to bring them out.
Mm-hmm.
Like,
Because
it's
that's the whole
funny.
thing with mental health. Like, I was really shocked in the beginning. I thought I had to, when I first went into it, I thought, I need to fix everyone. I need to fix everyone. Absolute crap. Like, no, you need to sit and listen and help that person find those conclusions for themselves, because it is in all of us.
I love that.
It
I
is
love
in all of
that.
us.
It's one of the things that I've learned through volunteering at Samaritans. I never realised before just how important listening is, because I did what everyone else does. You listen to respond.
Yeah.
But because that organisation part of it is you're not allowed to give advice. It's like having your hands tied behind your back,
It is.
and you are forced
Yeah.
to just listen.
Yeah.
And just being able to do that and being in that like magical sort of scenario with you and another human. And so often, not always, but so often, just listening lets them unpack and organise their thoughts,
yeah,
and they do fix themselves.
Yeah.
And then they thank you afterwards. You know, thank you so much. You've really helped. And it's like, actually, I've done
I
nothing.
didn't do anything.
Yeah, I've just listened to you, and you fixed yourself.
No.
And again, enabling people and giving them that power back to say, you can do this. Like you just did it.
Yeah. Yeah.
You know. But again, I think that really highlights the power of conversation between two people. It's one of the things I love about podcasts is because I feel that long form conversations. How often would you, like, I don't know how long we've been recording now, an hour and 40. My eyes, I'm getting old. Like, how often would you go and sit and talk to somebody for an hour and a half or 2 hours that you've never met before in today's day and age?
Rarely.
Yeah.
Yeah.
Whereas I think it used to happen more. You'd have meetings in social situations.
Yeah.
Now it just doesn't happen.
No.
That's why I love doing this. You know, like long form conversation to me is like, it's a beautiful thing and it's a forgotten thing, or we're losing it.
Yeah.
We're losing it.
Yeah.
And just having it and having guests and everybody, you know, that sits across, like everyone is here for a reason. It's because we want to talk. We want to talk about these things. We want to put the world to rights and talk about what's going wrong and what's going right and how we can help people. So yeah, it's really important to be able to listen.
It is.
And in your jobs, it's vital in both.
I think conversation in general is something which, even if I'm not conducting the therapy, I am enabling someone to learn to talk again sometimes. A lot of people come into services and they've become so isolated, and all the conversations they've been having have been online conversations, text conversations. So actually sitting down and learning to talk again is a big part of therapy. And being able to articulate what you're feeling is a big part of it too. And I think it will become more so with younger generations coming through, where they've had so much more social media and, you know, online interaction than maybe our generation did.
Yeah.
So yeah,
it's frightening. That is frightening. I mean, me as a parent of two kids, I mean, my daughter's 11, but I've sort of like been really conscious of that. So I've worked with them, and their communication's great. Like they can come and talk in a room of adults, you know,
which is great.
Yeah, it's just little things. Like ever since they were a kid, if we went out to eat, they've always ordered their own food. You know, it's the waitress or waiter would come over and sort of, you know, my son used to do it. He'd look at me and go, "Dad, can you ask for this without that? And, you know, can I have a burger but take the sauce off and this, that?" And I'll be like, "Mate, I don't work here. Why are you asking me?" You know, and I knew he'd be nervous, but I always pushed him. And my daughter's the same. So now they're bold as brass. You know, if somebody comes over, they're like, "All right, can I have this? Can I have that, please?" And their manners are there and everything. But those little interactions make all the difference.
So
because now, like, my son will walk into a room of adults he doesn't know and talk. You know, he's not shy. He doesn't. Yeah, he can communicate. And it's something it seems so like
It's so
taken for
basic,
granted.
isn't it? But
Yeah, and I think that's maybe one of the
yeah.
problems is we take for granted that people can communicate when it's a skill like anything else, and we have to teach our kids
Yeah.
exactly that, to communicate. But there we go.
Definitely true. Yeah.
The one thing I didn't ask actually, because people might be listening to this and think, "Do you know what, she sounds great. I want to have her come and design my house or give me colour schemes and, you know, put me in the right space." What areas do you cover, Victoria?
So I cover nationwide as a virtual service, and then
How does that work?
So I will do a virtual consultancy over Teams or over
Like a
FaceTime.
walk round
Yeah, like
kind
a
of
walk
thing.
around. So
Okay.
in that instance, I will send questionnaires in advance to a client and request sort of images of their space and to understand what the aspect is, because the light changes the color quite drastically. And then I will have a telephone conversation with them and then follow up. So that's the nationwide service. The in-home service, I'm based in Gloucestershire, so I do like a 20-mile radius of Gloucestershire, and then I cover all the counties which border it. So there'll be a little bit of mileage on that, but essentially, like, going to the home is ideal because I feel someone needs to really trust you and invest in your ideas and the fact they believe you understand them at that inherent level, which so in home's amazing.
Okay. And what service do you offer? Is it colour consultation
So
only,
yeah, at the
or
moment I'm just doing colour consultation
okay?
because I sort of early days for going it alone. So I worked at Farren Ball previously for several years. So did all my training through Farren Ball. So yes, this is kind of new doing it myself.
Do you recommend colours now other than Farrow and Ball?
I do. Oh my God, I'm a decorators that hate Farren Ball. I'm just going to put it out there. Like, I'm very, very aware of that. And I'm not.
Do you know what, Victoria? I was going to bait you with it and just ask you the question of what do you think about Farrow and Ball paint?
Okay. Off the record. On the record, I use exterior eggshell everywhere. Best product.
Okay.
Lower VOCs than all the other eggshells. Really good stuff. And dead flat is very good in pale colours. Can be a bit of a picture framing issue in darker colours. I think a state emulsion is amazing for breathability, older properties, but it is so delicate. I mean, Farren Ball have really pushed this is a big word, this metamerism thing. Do you know what this is?
Nope.
No,
Haven't heard that one.
Absolute right. So this is basically metamerism. So when you
have they made that word up?
Probably. I mean, it's Farren Ball, probably. When you colour match, you can look at two colours under the same light source and they will look the same, but they're made up of different pigments. So when you change the light source to say you've then got 4K bulbs on and you didn't have previously, they will look different because they have different spectral energy because they're made of different colour pigments. So
between a real Farrow and Ball and a match.
A true Farrow and Ball and a match.
Okay.
So yeah, there's a very big push on that.
Spectral energy. I'm just pre-preparing myself for the next person that could. Because if I was stood in a house and a customer said to me, "We have to use Farrow and Ball's genuine paints because of their spectral energy,"
I'd be like, "Oh my God!"
Yeah, I think I'd take a step back.
But I'm very, very conscious of durability, and it's often not there. And there are so many amazing products out there. So I am really happy to spec. Whatever. I'm obviously totally no inside out Farren Ball and little green colours. I mean, but if a client wants a certain company,
from my point of view, and as you know, I'm a decorator. I think Farrow and Ball's colours are brilliant. They're always on point. I'm not a big fan of the paint, if I'm honest. I don't like the whole fact that you have to undercoat to use the top coats. Farrow and Ball will claim that their paint's covering 2, but you have to use the undercoats. I'm like, that's still 3. The opacity doesn't impress me. Haven't used the dead flat. I know a few decorators that have said it's really good. Have had picture framing on darkers, but the light colours have had some good response. I I'll be open. Like, we use a lot of Johnsons,
Yeah.
so
Yeah.
and they're perfect matte, which is dead flat as well.
Yeah.
It's 2%, but it's also
Yeah.
scrub rated. So there's a few bits. We won't go too far into that. But
No. I don't have just because that's my background. That's not my necessarily my
yeah.
preference. It's about the colours, not about.
Look, everyone knows Farrow and Ball
yeah.
for a reason.
Yeah.
You know, I think Little Green are great. They do a great colour range, and the
Mm-hmm.
quality of paint's really good.
Yeah.
So yeah, there's a few out there, but that's interesting to know.
Yeah. And also the virtual service works really well for the client who comes in and says, "Oh my god, my decorator's coming tomorrow. I don't know what color I'm putting on the wall."
Yeah.
So that's a very a good option if people.
To be honest with
As
you,
a decorator,
Victoria,
if you've suddenly got a client,
yeah,
and you think,
I recommended Farrow and Ball's colour service to a few customers because I always thought it was really good value.
Yeah.
To get a designer out. I can't remember. I don't know what they charge now, but the last time I knew it was about £180 or for 180 or 240. I don't remember. To get somebody to come out to get all your colours sorted, I thought that's pretty damn good value. And yes, they would always try and sell the package of paint afterwards. But we could navigate around that. But yeah, I always thought it was a good package, and as I say, the colours are great. So getting back to you though, you do your virtuals for anyone in the country, and then the in-person for
so in-person would be
local.
Gloucestershire, Wiltshire, Herefordshire, Oxfordshire, out towards Bristol.
Do you cover Worcestershire?
And up here to Worcestershire.
Oh, fantastic. Okay, Interiors by Victoria for anyone that's looking. Obviously, I'll put all your details again in the post and all the rest of it. But where can people find you?
So Instagram Interiors by Victoria, and my website www.interiorsbyvictoria.co.uk.
I'll put all the information on the website. On the website, I'll put all the information on the description for the podcast. There we go. Is there anything we've missed out that you want to talk about, Victoria?
General mental health questions. I don't mind really.
Big umbrella again, isn't it? Big umbrella one. There's nothing that springs to the top of my mind, but I could certainly bear it in mind for the future. I'm just trying to think now. I feel like I'm going to miss a golden opportunity if I don't. Is there anything that's really? Well, actually, I'll ask you the question that I've asked quite a few of my guests, which is, why do you feel that the construction industry is so adversely affected when it comes to male suicide rates?
So probably a lot of the reasons will echo what past guests have said. So I think it's a lot of working in isolation, lots of thinking time. I think there is that background quite often of an undiagnosed ADHD, or that label of being the naughty kid at school, or the disruptive kid, and maybe falling into a trade and then managing really, really well, but then not having maybe the strategies when it comes to managing others and being responsible for other people's wages and all the pressures of that. And then kind of running your own business, and again, all the pressures that come with that. I think it's the whole men don't talk quite so readily. It's much harder. I think, what does self-care look like for men? It's a huge question. I know some of what you said previously was education for yourself was actually a big part of your self-care. But I think where self-care for girls is quite obvious, it's much more apparent. I think that's a really
you're right, actually.
Question.
I mean, the self-care element, because it would be quite normal for a girl or a group of girls to go, right, we're having a spa day, or we're going for lunch, or we're doing this. Men don't do that.
No.
And I don't know why we don't. Why don't we turn around and go, do you know what? I'm having a day where I'm going to go and chill. I'm going to go and have a spa day. Spa day with the lads could be a thing. Could bring that out. Spa days with the lads. But why don't we do that?
Exactly.
There's
or
this
does
weird
it then
pressure
around like alcohol and stuff? So listen to someone like Tom, and he was saying that journaling was a big thing for him. That's a really great coping mechanism, grounding technique. But there's elements of that which are self-care, meditation, which are self-care. They're not always things which are compatible with everyone, but I think it is testing out different things.
We'll just push into that a little bit, because you mentioned journaling with the eating disorders as well. Explain journaling.
So journaling is just getting your stream of consciousness onto paper. So taking it out of your head. So when there's so much stuff buzzing around your head, take one thing out of there and put it on paper. You're not going to forget it because it's there, although you can rip it straight up and get rid of it, but it's no longer a priority in your head at that moment. Sometimes it can be very difficult to say something aloud, but you can write it down. It might be something that you think is really irrational. I've taken patients out before, and they've been, for want of a better word, having a psychotic episode in the middle of Costa, and they're like, I've just got to write this down, because otherwise I'm going to go at someone with that wooden cutlery. The situations that you wouldn't expect it to be useful in, but yeah. So I find journaling's a good one.
Okay, so journaling's a good coping mechanism for it. It makes sense actually. Yeah,
Too,
I've spoken a few times about like the weight of thoughts, the weight of emotions,
yeah.
and I guess that's a coping mechanism of putting it down.
Yeah.
Maybe if you can't have a verbal conversation with somebody, journaling is like a conversation for one.
It is
almost. Yeah.
It is.
Okay, that's good.
And then a lot of the kind of self-soothe techniques, which DBT covers. So it's all about tapping into other senses. So obviously eating disorders, taste is not great, but music, so sound or things that make you feel comforted, or tactile stimulus, so things that bring you back to the moment. So sometimes people have something maybe very slightly sharp that they can press into their hand, and it kind of brings them back to the moment. And things like smells, whether it's like Chanel No. 5 or Rescue Remedy, like something that kind of just brings you back. Okay, I'm okay. And even just sitting, physically grounding yourself on the floor. So not with maybe slightly more violent patients, but I do sit on the floor a lot with patients. And in part that is, it stemmed from in the beginning, it stemmed from not wanting to ever tower over someone and feel like imposing and all the body language stuff. But actually, you have really good conversations sat on the floor because there's no threat. It's all very open. It's almost quite childlike, isn't it? So people kind of unravel a bit more in that childlike way, and it's really powerful.
Something to be said for the Eastern philosophies and like the Japanese sat on floors.
It is. So no, I don't know if I've gone off topic, but
so where were we? We were at we're in coping mechanisms. We're just talking about the potential issue in the trades and as to why that would be.
And certainly if you are trying to avoid drugs or alcohol, all those kind of guys, night out, let your hair down, it always tends to revolve around those things. So that is that's quite a difficult thing to navigate, and that can be quite a lonely place. So it's really having friends that understand and go, yeah, actually, we're all not going to drink, or none of us are using substances right now, or
But also, I think recognising that it's okay to step away from that. Sometimes you need to find
completely.
a new tribe.
And you might need to find a new tribe. Yeah. That too. I mean, the number of my guys that when they leave hospital and they've gone through a detox program, they are then back in their home or back in their little flat, and every person that calls their phone is a dealer. And it's like, that is such a difficult place to be when you're isolated and you've gone back into the same, and this kind of comes back to the interiors thing and the wellness thing. Like, I don't want it to all be about high value clients. I'm very aware that is a big part of it, but ultimately I want to be able to do community projects and hugely subsidized things that really help people who need it and who are, going back into environments that are not conducive to good mental health.
Yeah, it's really important. Yeah, you've made me think on several occasions, to be fair, Victoria. I think it's really, it's really important to try, and it's another piece to the puzzle.
Yeah,
it really is. And having a safe, nice home environment that, the mood of the room, as I referred to, having the correct mood of the room. It's just another coping mechanism, isn't it? It's another thing that can help you.
It is.
When you start combining those things like journaling, having the mood of the room correct, your environment, it's also important.
Yeah.
And it comes under that umbrella of self-care, doesn't it?
Yeah, it does.
Yeah.
And I think it's also that being able to stop when you get through your door. So like I said earlier, like surrounded by stimuli all the time. And it's a bit like when we were younger, if a child was being bullied, they came home, they shut their door, and they were away from it. And now it continues, doesn't it? It revolves around you.
Yeah.
Whereas there's still something in if you enter your own space and it helps you to unwind and it gives you a like a mental reset, you can kind of face the next day again.
Should be a safe space, shouldn't it?
There's something, something in that.
Yeah, it should be a safe space. It's one of the biggest, I think, issues with social media and kids and bullying, isn't it? Because there's no escape now. They don't get to go home and switch off.
It's the same for adults. It's the no switch off thing, you know? Ice diving's amazing too. I meant to mention ice diving. So not as in you don't have to have like the full tank.
Yeah.
But so one thing I do with a lot of the girls and guys is ice diving with your face. This is a good place for you to start. I know you're scared of the tank, right?
Yeah. No, do you know what it is? I've done cold plunging like a few times. Funnily enough, I've had spas, and I actually enjoy it. I like it, because I get competitive. So I'm like, yeah. But what I can't do is the early morning cold showers.
Yeah,
can't do it.
No, I get that. So when someone is at point of, okay, I'm gonna go purge, I'm gonna go cut myself, whatever it is. Ice diving is amazing. So fill a sink with ice cubes and cold water and submerge your face for 30 seconds, deep breath, another 30 seconds, and it calms your nervous system. So it redirects the blood flow to the heart, to the brain, so you can think again.
Okay.
It's a complete reset.
First time I've heard that. So that's interesting.
Good.
So
good.
To repeat that,
for guys as well.
Fill a sink with cold water and ice
cubes,
and bang your face in it for 30 seconds at a time. Count out 30. Yeah. And that will reset. Do you get the dopamine thing?
Or, it's the whole thing. Same mechanism.
I might be able to do that.
It's a good starting point.
Yeah, it is. Yeah. Absolutely. Fantastic. Well, I think with that peach of a sort of bit of advice at the end, we'll probably wrap it up there, Victoria. So once again, massive appreciation for you giving up your time, coming and talking, and we're all doing this for the same reason. We're all trying to help people. So I'm sure that your conversation is going to be of interest to those that need it. And we've discussed where people can reach out to you. Are you happy for
please
people?
Reach out to me with like mental health stuff. So I've worked, worked in substance abuse. I've worked in lots of areas. I've worked with people with dementia. So if there's any concerns for older family members, as well as the topics I've talked about. So yeah, please do.
Victoria's details will be on the episode, so please do reach out if you need to. And on that note, that's the end of another episode, and I will catch you on the next one.